So please join me in welcoming two speakers, Dr. Jeoff Drobot and Dr. Dickson Thom, in treating biologically from the neck down. Dr. Dickson Thom has over 40 years of experience as a clinician and holds degrees from the University of Toronto's Faculty of Dentistry, the National College of Naturopathic Medicine, and Ontario College of Naturopathic Medicine, where he obtained his doctorate. In 2009, he received his VIS Award from the American Association of Naturopathic Physicians for commitment to the healing power of nature, and he has written numerous articles about energy, medicines, and nutrition. Dr. Jeoff Drobot is one of the founders and medical directors of the American Center for Biological Medicine. He graduated from the University of Calgary with a degree in exercise physiology and then pursued his doctorate from the National College of Naturopathic Medicine in Portland, Oregon. Dr. Drobot is a leading authority in the fields of European biological medicine, chronic and autoimmune disease treatments, detoxification, hormonal balance correction, and customized sports medicine and nutrition programs. Please give your warmest welcome to both doctors to start us off this morning.
Good morning. I'll go back first. It's been a rather long time since I spoke to a group of dentists, which the last time I spoke to a group of dentists was the Ontario Dental Association in about 1980, when I suggested that we stop using amalgams. It wasn't well received. That's why I'm not practicing dentistry anymore. That's why I became a naturopath. So for the last 25 years, we've basically been doing more of a consulting aspect from a dental perspective of practicing. So what we're going to share with you this morning is what we do at our clinic down in Scottsdale, basically to try and take medicine to a different level. So most of the patients who come to see us have nature of some chronic illness. Probably 40% of the patients we see have stage 3 and 4 cancers. 30% of the patients probably have chronic infectious. Now, just Lyme disease is probably the most common one that we end up seeing. And then we see a whole host of everything else, neurological diseases. So quite patients who are sort of, at the looking for something that they haven't been able to achieve through the system that they have. So, our tagline is restoring health from chronic illness. So the first thing we have to look at is, how do we describe health? And the World Health Organization has used the same definition since 1948. So it's not really exactly this is what they say it is. It's, the state of complete physical, mental well-being, not merely the absence of a disease. So we have, we take it beyond that, because no matter what a patient comes to see us with, we try and boil it down to, why do you have the problem? As you'll see, our goal is not to really worry about what their symptoms are, because the symptoms never seem to be what the particular problem is. So we know that health really is being in a state of balance, the state of homeostasis. And allowing the body to be in a state of homeostasis allows the body to return to normal. So there's these, I won't say simple, but there's these 5 areas that, if whatever you do for the patient, you can get them these 5 areas in balance, you'll find that many of their problems will go away. So, and many of our therapies are based on reestablishing these 5 areas. And these are not the only 5 areas, but they're just 5 areas. So the first aspect is the simplest component of health. It's simple breathing. And it's amazing how many people who have a chronic illness feel better just by breathing. And because what they're doing is that they have an imbalance of the amount of oxygen going in and the amount of CO2 going out. So almost invariably, when you do a chem screen on chronically ill people, you see that their carbon dioxide in their blood is high normal, but generally means that they're holding on to their breath and they're not able to release it. And almost invariably, when a patient has anxiety and worry about things, you'll see one of the most common things is that their CO2 is high. And so the simplest treatment for them is you need to focus on breathing, simple breathing. So people who do yoga or Tai Chi or Qigong or some type of meditation practices where they focus on their breathing actually feel better. That's part of the therapy itself for what's going on. So it is the way that we remove the most waste products from our body is breathing. Breathe about 17,000 times a day, generally speaking. Breathing 12 times a minute or so. But most people only breathe from the top of their lung, and they never really remove all that waste product from their lungs. So they don't actually move their diaphragm. If you don't move your diaphragm, you don't massage your liver. If you don't massage your liver, you basically are not activating your filter on an everyday basis. The pH of the internal environment is different in every tissue. The pH of your stomach is a lot different than the pH in your heart, which is very different than the pH in your small intestine. This is very different than the pH in your brain, etc. So we hear a lot now about alkalizing. The body needs to be in an alkaline environment, and the extracellular matrix tends to more alkaline, but it's different in every tissue. So, people will say, well, we'll use a pH strip in your saliva, or we'll measure your first morning urine. We'll see if we can alkalize it. It's very difficult to do that, generally speaking. It is well acknowledged that a higher pH and a more acid pH is associated with chronic illness. So by just clearing out the extracellular matrix around the cells, does quite a good number of changing in the direction that you're looking for in all these specific tissues. So getting rid of waste products is one of the greatest challenges that our physiology has. And as we'll talk a little bit more about that. And then, of course, you got to get the proper nutrients in. So, and a big aspect of nutrition isn't what you're eating. It's what you eat, and then you have to be able to digest it, then you have to absorb it, then you have to eliminate waste products. So food choices is only one aspect of what's going on. The proper concentration of electrolytes. Vitamins are relatively easy to get in. Minerals are not so easy to get in. So minerals are generally a bigger problem, and so, people buy multivitamin, multiminerals. You're better off often doing multiminerals and don't worry about the vitamins. The vitamins, from a food perspective, are not a challenge. But because minerals are rocks, literally, they're a lot harder to assimilate. And the form that you're using minerals in also becomes a factor as far as overall health is concerned. And then the volume of your extracellular fluid. We'll show you some of the evaluations we do to be able to determine why people hold on to so much toxicity. So, from a dental perspective, what you're thinking about is, well, we got to if they have amalgams or root canals or whatever that toxicity is, how do we get it out of there? It's one thing to just get it out of their oral cavity. It's another thing to get it out of their entire body. And it's not just the oral cavity that's involved, because this waste product accumulates throughout the body and every tissue. And that's really what we're more interested in. So health is a balancing act. It's a balancing act between whether you chose your parents well, and if you did, you probably genetically are perhaps a little bit better off than someone else. The lifestyle that you chose and choose to live by, and then since 2003 with the epigenetic discovery of the human genome, that we only have about 25,000 genes, 150,000 proteins. It's like now we know that one gene codes for more than one protein, which is like, oh, that's kind of revolutionary. We didn't think that was the issue. So now we know we don't have to necessarily change the gene. We just have to change the expression of the gene. And lifestyle does a tremendous aspect of doing that. And so what somebody eats can change their epigenetic structure. So it's this constant balancing act that we are trying to achieve for people. Of course, that's in contrast to disease, where it's in the constant state of imbalance, and you never get into a place of balance. The body is like on this teeter-totter that is not very successful in getting where you need to be. So this is the state, in the United States anyway, of what's going to happen to chronic disease. So each decade, there's millions more people who are being diagnosed with chronic illness. So starting from 95 to 2030, 171 million people in the U.S. will have some state of chronic illness. One of the unfortunate aspects of that, was acknowledged back as far as 10 years ago, that the present system 10 years ago couldn't treat chronic disease. So chronic disease, at least in the U.S. system, sure is no different than the Canadian system, is unsuccessfully treated because there's not the proper tools. There's no tools, they don't know how to do it, and they don't have enough time to spend with the patient to figure out why they have the chronic disease. They have troubles treating acute illnesses, let alone treating chronic illnesses. And so the number of chronic illnesses are just going to continue to escalate unless, obviously, something changes. So, why are chronic diseases increasing? By definition, a chronic disease is a condition that if you don't do some form of intervention, will never get better, which is different from an acute illness. An acute illness is really the simplest definition of an acute illness. You'll either get better on your own or you'll die. That's really what an acute illness is. And many people have acute illnesses and don't die from it. And many people have acute illnesses, not so much in the Western world, but if we were to go into Africa or third world countries, people die of diarrhea. The most common infectious disease in the world that people die of is, anybody know? Most common infectious disease, the most common disease that people die of acutely. Malaria. So malaria was really common here in Canada and the U.S. You'd see that there'd be a lot more, treatment for it per se. But malaria kills tens of thousands of people, unfortunately. Not in this country, but it certainly is an infectious disease. So most people, the vast majority of people do not die from acute illness. The vast majority of people die from chronic illness, of course, which because of intervention. So we call it the 5 T's of managing chronic disease. So we feel that for whoever you go to as a patient or whatever, these are the 5 areas that we feel need to be managed for supporting somebody who has a chronic illness. So if we don't manage all those 5 areas, all we do is we make people feel better, but they never really get better because they can't. So we call it the 5 T's of chronic disease, and we're only going to make a brief mention of them in this. So the first aspect is what we call the terrain. Why are some people in balance, and why are some people out of balance? Everybody says, why did you get sick? Why did somebody get sick? If we were to have a discussion here, people would come up with the number one reason that people feel that they get sick is what? No, that's not. Stress is a common one. It's not the most common answer. Germs. The germ theory. The whole idea that it's microbes. So every parent who has a kid in daycare says, well, the reason I got sick is because my son or daughter brought it home from daycare. So I said, what, did they put it in their backpack and dump it on the floor? Like, how do they bring it home, per se? So the whole idea is that the germ theory is the theory that, in all honesty, I don't really believe in. I believe germs can make you ill, but it's not the reason you get ill. Because you could expose 100 people to the same germ, and they won't all get sick. So it's like there's got to be something else that's underlying. As I said earlier, we treat a lot of Lyme patients in our clinic. But if any of you are from the Northeast especially, it's ubiquitous. I mean, there's probably nobody in the Northeast who hasn't been bitten by a Lyme tick, or by a tick that carries Lyme. But how come they don't all have Lyme? So there's other factors that are involved, not just the actual microbe itself. So there's obviously a number of triggers. So we said stress. Yeah, stress is one of the triggers. It's one of the reasons that a set of circumstances and you may become ill. And it's a common one that people will often talk about, and whether it's a physical or a mental, emotional aspect. So the terrain actually is made up of 3 different areas that we end up talking about. One is your constitution, which for all intents and purposes is your genetic aspect. So why your hair color is what it is, your eye color is what it is, your skin color is what it is. It's why you're how tall you are, etc. So we have that particular aspect, which is what most people think relates to everybody says, what's your family history? So family history says, oh, if your mother or sister had breast cancer, then you have a higher risk of having breast cancer. Well, the reality is that's not the risk. The risk is the environment in which you were raised. Because we actually have the answer to at least 60% of cancer. We already know what the answer is, but yet we don't do anything about it. We know that there's 3 factors that if you were to change, you could reduce 60% of all cancers. Don't smoke. Eat 9 different colors of fruits and vegetables every day. Do 5 hours of movement a week. Those 3 things would reduce cancer by 60%. But yet we don't see it advertised on all the public service announcements. What we see is research needed to treat the disease after you have the disease. Not how do we not get the disease. But you have to go back even a step farther, and so we look at these 2 other areas that are referred to as miasm and temperament. And for lack of better, for just as a summary aspect, miasm is an old term developed talked about in the 1800s by Hahnemann, who was basically the founder of homeopathy, which is one of the therapeutic tools that we use. And what he found is that in the principle of treating patients, that when he would treat them, they would get better for a period of time, but then they would get sick again. So he said, oh, there must be something else that I'm missing, per se. So, for sake of simplicity, refer to one's miasm, and you all have one. Everybody has a miasm. It's how you protect yourself. When you are exposed to something that's foreign to you, and whether that's a pesticide, whether it's a mercury and amalgam filling, whether it's a food additive, whether it's a virus, a fungus, whether it's HPV, whether it's hepatitis C, whatever, what you do with it is predetermined by your miasm. It's a predetermined response, what ends up happening. Some people, when they get exposed to things, immediately throw it out. They get a high fever, they get a rash, they have diarrhea, have that for a couple of days, and then they get better. You can expose 4 different people. I just do the 4 simplest ones. Another group of people exposed to the same things are not able to eliminate it, so they hold on to it. They literally try and encapsulate it, and so it stays in the body. Another type of miasm will try and literally poke holes in yourself. They get ulcers, you get leg ulcers, you get bloody discharges, those types of things. And all it's trying to do is try to get rid of what the body doesn't want, is perceiving as normal. And then some people don't eliminate well at all. And as a result of that, they can't make a fever, then their immune system starts to degenerate, then their endocrine system starts to degenerate, etc. So we have that whole aspect of this. Everybody in the room also has a specific temperament. And if, as you were going through high school and college, you probably read some of Shakespeare's plays. Shakespeare's plays, more than anything, talked about the different temperaments that we have. And there's 4 main temperaments, of which everybody has a particular part. And your temperament is also predetermined. Your temperament is why you chose to become a dentist. Why some people become firefighters, why some people become policemen, why some people become teachers, why some people become dentists. It's a predetermined thing. It's why you chose your partner. It's why you choose to drink coffee or not drink coffee, or why you choose to drink beer as opposed to liquor. These are all predetermined things. You said, well, I like it. Well, there's a reason you like it. It's because it's part of your temperament, per se. And what's interesting, the most common foods that are eaten, food and drink in the United States, is beer and pizza, which just happens to be the melancholic temperament. And melancholy happens to correspond with melancholy, which happens to be more sadness and depression. And since 40% of the U.S. population is on an antidepressant, puts a lot of people into that particular temperament. And it's a predetermined factor. It's like, I don't have anything to do about it. Yeah, you have something to do about it, but it's predetermined. What you do about it is up to how you end up changing your day-to-day and your lifestyle. And as I say, Constitution is more about how do you deal with events that happen in your life. That became, as all these big lotto winnings, when people would win $500 million, they'd say, oh, if I ever was to win $500 million, this is what I would do. And you have this assumption, and if somebody says, well, if we're going to give you a check tomorrow for $500 million, what would you do with it? People say, well, I give it to this, and I do that, and I donate this. We hear all that. But now that there's been so many of these big winners, we see that's not what they do. Because it didn't follow their constitution. Because it's a predetermined thing what you're going to do with it, even though you think you're going to do something with it, you don't. Because these things, all these things that are affecting your terrain are literally predetermined. And basically it's up to you just to live them out. So why do people have chronic illness? It's because they unfortunately are incapable of managing their toxicity. The amount of toxicity that, and we're using the word toxin in a sort of a generic way for in general here, not just mercury, for example, not just cadmium, not just lead, not just heavy metals, but we're talking anything that basically is perceived to be toxic to the patient. So the most common toxin that we got to get rid of course, is our natural toxins, which is our own waste products made by every single cell. We have 10 to the 13 cells that are constantly, eating and pooping, and that you got to get it out of the body. You got to get it out of inside the cell into the extracellular space and then outside the body. But unfortunately, what we see in chronic illness is people are not efficient at being able to do that. Most of the time we talk about toxins as being the xenobiotics, some things that are produced exogenously, things that we are exposed to from the outside, like heavy metals, from dental materials, for example. But there's also one of the aspects that's probably more significant is the emotional toxicity, as we'll see in a second. Then there's even the dogma aspect of you have to do something in a certain way. In order for the body to get rid of something, it first has to recognize that it's foreign to you. And unfortunately, many times the body doesn't recognize that. It's our experience in medicine that one of the main reasons for autoimmune disease, which is continuing to escalate, which we have over 80 now recognized autoimmune conditions, almost invariably, when you go back and look at where people have come from, as far as their health is concerned, I almost invariably can find when the autoimmune disease started, and it's almost always before age 7. And you'll see it over and over and over. Yet they don't show up until they're 42 or 57, or they're 28 and have rheumatoid arthritis, or they have Hashimoto's disease, which is one of the most common autoimmune conditions of the thyroid, showing up much later. But it's an event that happens to them at the time that their immune system is still in an immature state. And if we look at the development of our immune systems, when a baby is born, it's a long way from having a normal immune system. So, the whole idea, should we immunize a baby when they have no immunity to be able to react against the immunization? It's like, when can we make antibodies? Why would we immunize a baby for hepatitis B when I haven't seen too many sexually active or drug addicts at birth? which is really the most common exposure that they're going to get. But of course, the reason they do it is because by the time they become promiscuous at age 8, now as young as 8, or let's say 10, it's like, well, they're never going to go to the doctor, so it's too late. So they say, well, we'll just do it at birth, and we'll do it from, that type of thing. So I believe that, and of course we have immunizations, we have I would say the overprescription of antibiotics, especially in young children, basically for viral infections. So you give enough antibiotics to a kid, basically the virus has just become impregnated into their tissues, and the body no longer recognizes that the virus is foreign to me. It doesn't know how to react to it. And one of the tests we do for many of our patients is we do a viral screen. People have hundreds of viruses. So most people we test have the Borrelia, they have Lyme, but they don't react to it, but they've been exposed to it, even if they didn't grow up in the Northeast. Because we're exposed to all these things. The question goes back to the whole terrain issue. How do we end up dealing with it? Once the body does recognize it, you then have to be able to neutralize it, which means you need a number of systems to be able to effectively do that. And then, of course, you have to be able to eliminate it over a period of time. So, but remember that the toxins are not really just about the physical substance. In fact, it's my belief that the greatest toxin is emotional. 87% of our self-talk is negative when we talk to ourselves. It's always negative. Only 13% of our self-talk is positive. So I like to use the analogy as you try to live above the line. So when you live above the line, no matter what happens in your life, and people say, oh, it's like, woe is me. So instead of worrying about loathing and grief and disgust and surprise and sadness and pensiveness, let's live in this place of serenity and joy and trust and ecstasy and interest and acceptance and optimism and love. Because the more you live above the line, the more the emotional toxicity is easily eliminated. And this plays a huge role in chronic illness. Almost invariably dealing with patients who have chronic illness, and you say, why does one patient with stage 4 breast cancer survive? Another patient with stage 4 breast cancer doesn't survive. It could be the same treatment. And it's not the treatment that's different, it's the attitudes that's different. It's the aspect of how do they engage the individual process for what's going on. And I'm not saying it's all about attitude. It's one of the pieces of the puzzle. And if we don't take this into account, this emotional toxicity has a pretty destructive component on many people's health. And very often you'll be treating somebody and say, I wonder why this person doesn't get better. You know, that's why we don't necessarily treat conditions individually. So this whole idea, is, this. So we've talked about terrain and talk about teeth, which is not something I'm going to talk about in this group because you're already familiar with how the organs, each tooth is related to a different organ. And many times, and I remember years ago, probably 35 years ago, very first time somebody came in and complained to me that their eye tooth, their upper eye tooth, their number 13, was painful. So it wasn't spraying, and they didn't have any sinus problem. You take an x-ray, they didn't have any fillings in it, and it's like, what's wrong with that tooth? You tap on it, oh, that hurts. They didn't have anything wrong with the tooth, but they had trouble wrong with their gallbladder. And they needed their gallbladder removed. As soon as their gallbladder was removed or treated, pain in their tooth went away. So it's like, wow, this stuff does relate to each other. And many times you can relate a physical ill that the patient is experiencing to a problem in a tooth. And just as you can look at the person's ear, the ear is mapped body, the bottom of your foot has the body mapped out on it. We can use the teeth also, basically as mapping it out. So you people are certainly experts in that whole idea of looking beyond just the mouth itself. So making a diagnosis. One of the greatest challenges in medicine is that we use a model that's broken. Dr. Drobot and I, a couple of weeks ago, were at a conference in the Bahamas where a person from IBM did a presentation on Watson. Have you heard of Watson? You know what Watson is? Watson's a supercomputer. Watson is a supercomputer that basically, it's interesting. They made it interesting. In order for a doctor to keep up with the amount of data that comes out every day, it would take 160 hours a week just to read the material. That's how much material is coming out. Now the data in the world is increasing every 2 years. By March the 21st, 2016, the amount of data that we'll know will have doubled from all time. By 2030, right now, Watson has the capability of having the brain power of a single individual. By 2030, Watson will have the brain power of every single human on the planet. Over 6 billion people will be in one computer. 2 billion jobs are about to be taken over by Watson, which is about half the workforce in the world. It's like, whoa, these are pretty amazing statistics to start thinking about. So what are people going to be doing? Well, we don't know what they're going to be doing. All we know is computers are going to take it over. We already have robots. There's a company in Germany, I think, that has a huge factory. They have 150 robots and 6 real live bodies. 6 live bodies running this massive factory because it's all being run by robots. And that's coming. That's already available. So by 2030, when all this information is doubling. So we basically have a system of medicine. So the whole reason I tell you the story is because they're building Watson to be a doctor by putting all this data in. So you'll just sit in front of, in fact, you won't even need to be a doctor anymore. Just need somebody who knows how to type. It's like, tell me your symptoms, and they put it in, and Watson says, you have a 95% probability that this is your problem. And then press his button, this is what you should do. And so I went to talk to him afterwards, and I says, well, I have a problem with this, is because your model is broken. The model already doesn't work. You're using the same model for the last 200 years because you don't know how to treat chronic disease. All you're doing is putting more data in, but you're not getting any new solution out. So if you don't put a new solution in, you're still going to have a broken, and he said, oh, that's an interesting aspect. He said, I guess we need somebody else to program the computer. I said, I think so. Because all you're going to get out of it, and he denied that it was pharmaceutical based, but it's like, what's the treatment plan? It always was a drug. You have this disease, here's what you take. I said, yeah, but I don't use any of those. I don't use any of those medicines, so what am I going to do? He says, well, I guess you won't have a job. Maybe not. So in contrast, we're basically looking at a totally different model. We're looking at what we call a wellness model that is much more proactive. And the way I like to think about it is, if you look at specialty in medicine, the specialty in medicine basically only deals with what's going up in the leaves and the trees and the branches. So the problem is that if you go to each of these specialists, which are a dime a dozen per se, they only look at one piece. They're literally looking at one branch of an entire tree. But more importantly, they're not looking at what's going on down here. And it's down here that will determine whether you have leaves on the tree or not. It's down here in the terrain that will determine whether or not this tree will live or not. It's whether the leaves will fall off or whether the leaves are turning brown. It's what's going on underneath the ground that determines whether you need to see anybody above the ground. And the present model is, wait until it's totally broken, wait until this soil is so arid that you have no nutrients, you have no fluid, dehydration, congestion. Oh, then we'll go and see the specialist who'll say, oh, you have a problem in this. So that's why I think the whole system is broken. And what Watson is going to tell us, it's going to tell us, oh, for neurology, here's the data we need. But it's not going to come up with, but why is there a problem down in this particular level? And that's, of course, what the issue is. So how do we do an analysis, or how is the analysis typically done in medicine? It's sort of a standard approach. You go to the doctor, they take a history, they do an appropriate physical exam, and then they'll order some type of tests. And then they open a book and says, oh, this is what you have, because we can then come up with, standard blood tests. We come up with a biomedical assessment, and here's your treatment plan. And if you have rheumatoid arthritis, you all have the same treatment plan. If you have Lyme disease, you all have the same treatment plan. If you have cancer, you have the same treatment plan, with very little variation, because specialists are good at what they do. So they have 5 or 6 tools, but they have no more tools in their toolbox. But as I said, that's the problem with treating that, is you're not really treating the problem. And that's where we have found that is the biggest issue, because that model is totally based on the patient's symptoms. And that's why Watson won't work. At least won't work for curing chronic disease. Because if you look at a person's symptoms, you're missing the opportunity to try and understand why somebody is sick. So, and we know it's not efficient. It even was published, said 11 years ago, the American Medical Association, we don't know how to treat chronic disease. We don't have enough time, we don't have doctors, and we don't have any expertise. All we can do is try and manage it, but we're doing a lousy job. Because what do people die of in this country and in the U.S.? Chronic disease. The number 1, of course, is heart disease. The number 2 is cancer. The number 3 is no longer stroke. The number 3 is now pulmonary disease from COPD, because smoking finally caught up. Now stroke is number 4. Accidents are number 5. So we have 80% of people dying of the top 5 chronic illnesses, which the reality is they're all preventable. But we don't think about the prevention. So we know that the model doesn't work. And if the model doesn't work, so what do? Is we basically tell people your problem isn't your symptom. Your problem is in your organ systems. Which organ system? And it's interesting that every one of these organ systems has a specialist associated with it except one. There are no lymphologists. There's no such a thing as the specialist in the lymph system, which happens to have 5 times as much fluid as your cardiovascular system, which is the most important component of your immune system. when your lymph system is congested, as it is in virtually all chronic illness, you're going to have a very difficult time getting past it until you treat the lymphatic system. And it's not that difficult. You've heard of lymph massage. The little mini rebounders are making a comeback. That's why 5 hours a week is important, because you have to move your body, per se. There's other types of therapies that can be very effective. So what we do for case analysis in our clinic is basically we look at all the systems. I've never seen a chronically ill patient who doesn't have at least 4 or 5 organ system problems. They invariably have a lymphatic problem. High percentage of them will have a digestive problem. A lot of them will have a nervous system problem and an endocrine problem, because those are our 2 survival systems. And so as time goes on and you get these systems out of balance, these people have a very difficult time of ever getting back into balance, because they're just treating their symptom. You can't treat somebody's symptom to correct an organ system. You have to treat the organ system in order to make that happen. So in addition to just doing standard routine tests, there's ways to evaluate organ systems that are more effective than a blood test, which is pretty ineffective. You probably know that a blood test, even before you draw it, 2/3 of them are normal, because of just the way the reference ranges are. And when more than 2/3 of people fall out the reference range, what happens to the reference range? They just widen it. Suddenly, now it's a wider reference range. It used to be that thyroid, for example, was 0.5 to 4.5. But on your 55th birthday, it went to 5.5. So from one day you were okay if it was 4.5, or it was 4.6, it was abnormal. Then on your 55th birthday, now you're normal. It's like only because so many people, as they age, their thyroid goes farther out of balance, so we'll just widen the range. So, and often you'll see on lab tests, they'll say we have a new reference range. So how did you get a new reference range? Because when we tested the last 10,000 people, too many of them fell outside the range, so we had to widen the range so we could get the people inside the normal range. So now you're still normal. So blood tests are really not very helpful, because it's an instant in time. And I always have to chuckle. There's an ad on television about Cheerios. I think it's Cheerios. It's like, oh yeah, or Special K, one of those. I ate Special K for 2 weeks and my cholesterol went down 8 points. Well, I could have made it go down 8 points by just retesting the same blood 10 minutes later. Because any lab test has a 10% error. And you can do the same test and the same test separated and see a different number. In fact, it just happened in one of our patients in a clinic had just had, for whatever reason, a blood test the day before. We did a similar test not knowing it was. And there was about a 20-point difference in her cholesterol in one day. But it's just because the labs record them differently. So blood test numbers don't tell us much. So anyway, there's a number of different tests that can be done, including digestive stool analysis, which is a pretty good test to run for most people with chronic illness. Simply because they don't realize, they'll say, well, I have nothing wrong with my digestive tract. You may not feel anything wrong because your system has stopped giving you the information. It's like when the red light comes on in your car because the oil is down. You have 2 options. You can go and fill the oil up in your car, or you can go under the dash and snip the wire, and then the red light goes off, which is often what happens. So when the signal from the digestive system to the brain gets snipped, it's not telling you that, people say, well, I have reflux, or I have bloating or gas. But many people will say, I have no problems at all. Until you do a stool analysis and you say, well, you have considerable imbalance, because you have a considerable imbalance of the flora that's in there. And this is not conducive to good health, basically, if you have a floral imbalance, whether it's candida or some other critter in there, what often it is. Salivary hormone tests, especially for the adrenal gland. And I would suspect a good percentage of you in this room, dentists certainly, and all your staff, have an imbalance of what your cortisol levels is on a day-to-day basis. People think, well, this is just kind of how it is. But anytime that your hormones are out of balance, it translates like a domino effect. There's something else will be out of balance. And invariably, the next thing that goes out of balance is the nervous system. Because you have 2 survival systems. We have the endocrine system, we have the nervous system. And they, as you will see in a sec from one of the tests we do, we can actually evaluate, how are those two systems doing. So with the saliva test, we can also look at a number of other things like melatonin. So in this person where it's really low, I said, well, surprise, I can't fall asleep. The other interesting thing about thyroid is, which is commonly measured, and for the Canadians in your system, you're probably just measuring TSH, which is like, well, I'm going to sit on this stool, but there's only one leg on it. The other two legs, I don't need any other legs, and I'm just going to figure out I'm going to balance it on this one leg. It really doesn't give you enough information, but even worse, if you measure somebody's thyroid hormone and their adrenal is out of balance, your thyroid number is also incorrect. So you can't really get much information from just measuring thyroid hormone unless you know what the adrenal gland is doing also. So it's important that we know both of those. Food sensitivity, there's 101 different types of tests that one can measure food sensitivities. Most patients with chronic illness do have problems with foods. And there's a variety of ways of doing blood tests and kinesiology and the COCA tests and the 8 most common food allergens, and this is the LCAT test, and that will depend on the individual physician. There's also a SpectraCell, which looks at nutrients that are they getting inside the cell themselves. Can they actually get in the cell? It's one thing to eat it. It's another thing to get it in. So people say, I ate a really clean diet, I really eat this. You do a SpectraCell on them, and you find that they are deficient in certain nutrients. Say, yeah, but I eat that food. Well, it doesn't mean because you eat it, it gets in. This is a pretty simple device that is very helpful for patients. It's not just a scale. It actually gives us an internal snapshot of what's going on with their cells, which is an important aspect from a health perspective. So we get a printout like this. There's an important component of this area, which is the intracellular and extracellular water. So almost invariably with chronic illness, what we see is that this bar that's represented beside the extracellular water is considerably longer than the intracellular, which is what it's not supposed to be. And all we need to do is look at that bar, and if this bar is longer than that one, you are holding on to toxicity. You have lymphatic congestion. They say, well, my ankles aren't swollen, I don't feel it. No, but you're probably 15 pounds overweight, and probably 10 of it is water, because it's all around your cells. Per se. And then people, well, in order to lose it, I got to dehydrate myself. Well, that's not going to be a solution either for that. But it's a really simple test that shows people just within an instant, one of your issues is definitely toxicity. And why do you hold on to the water? Because the body doesn't want to be poisoning itself. The water is a way that you dilute all this toxicity. It's extremely common in chronic illness. We see it almost 98% of the time on this simple test. It also tells us where you're holding your muscle mass. This is your muscle mass in your arms and your legs and your core. And pretty commonly, people will have much more muscle mass in their upper body, because without realizing it, we're using our hands and arms a lot more than our legs. And then when they're complaining about their hip and knee is sore, it's because their muscle mass in their lower extremities doesn't correspond with the muscle mass out in their upper body. And until you balance it, they're going to chronically have some type of a musculoskeletal problem. Pretty simple ways of looking at some of these things. Heart rate variability, which is what we're going to do this afternoon for those who are interested in a little workshop, to see how does your body respond to stress. So heart rate variability is at every instant, from your heart rate, how is your body responding when it's perceived to be under stress? So we can see, can the body adapt to it? Are you in constant sympathetic flight or fright, or are you in more of a parasympathetic rest and relaxed state? So the ideal is when we see this graph, if we look down here, this is sympathetic and parasympathetic. Ideally, you should spend about 60% of the day in sympathetic state, meaning you're awake, you're alert, you're aware of your surroundings, you're aware if somebody's about to attack you, you need to defend yourself in some way, and then we spend 40% of the day resting, sleeping, digesting our food. But almost invariably, this will be out of balance. There's a couple of markers that we can get up here also called total power and standard deviation normal to normal, which is all this wiggly line stuff. And it tells us how much reserve energy you have. So when you have a low SDNNN and a low total power, it means your endocrine system is already being depleted. So you're going to rely much more on your nervous system. So we say the sympathetic nervous system is like having your foot on the gas pedal. And the parasympathetic nervous system is having your foot on the brake. And many people are driving with their gas pedal to the floor because it's the only way they can protect themselves because they've depleted their endocrine energy. But then they have to stand on their brake, just like this person is, basically to prevent them from going off the cliff. So they're totally out of balance. And they say, but I don't feel stressed. Well, your body doesn't know that yet. And so you wait long enough, and suddenly you're going to have this chronic illness that's underlying because these organ systems get more and more out of balance. This is the one that those of you choose to do. We brought it with us. We do this test. So this is a lying down, and this is when you stand up. Now, how many would you think that when you go from lying to standing, that's a stress on your body? It is. That's a stress. It's like not many people think, well, I mean, when I get out of bed, I'm stressed. Yeah, you are. And even if you didn't sleep well, you're more stressed. Even if you had perfect sleep and totally rested, that action is a physiologic stress. And we can measure it, and we can measure a variety of markers, and we can see what happens from lying to standing. Now, this isn't what's supposed to happen. It should start about 1-1 and should go up in this direction if your body is responding normally. When we see different types of patterns from this very simple test, you can say that your nervous system is responding inappropriately to anything that your body perceives as stress. And it's not just these big stressors, it's everyday life. You ate the wrong food, it's a stress. You're hypoglycemic, it's a stress. You didn't get enough sleep, it's a stress. Work is a stress. These are all putting the nervous system out of balance, and we can measure it with that type of thing. We can also measure long before it's a problem with a digital pulse analysis, your response of your cardiovascular system to stress. This will tell you years before an echocardiogram will, years before an EEG will, years before a stress test, that you're going to have a cardiovascular incident. Because this will tell you how your body is responding to stress. Tells us we can look at tissue acidity. We can use it as a prevention because we get this model and we look at, these are representative of these bars. This is the big arteries, the aorta and the carotids. This is your cerebral vascular and the cardiovascular, and here's your peripheral. So if these bars are not in this green area, they're already getting stiff. They're stiff under the response of stress. The more stress you're under, the stiffer they get. That'll tell you long before somebody says, oh, you need a coronary bypass because you have blocked arteries. Oh, because your cholesterol is elevated. It's not about your cholesterol. I mean, we've known that for a long time ago. In 1900, 250 was it, sort of for the Canadians. I don't know what the Canadian number is. U.S., we're trying to keep supposedly cholesterol under 200. The LDLs are now, they're wanting from diabetics under 70, which is like, I'm not going to have any hormones left if we keep driving the hormones down. But in 1900, 250 was the normal cholesterol. Well, you didn't die of heart disease. Said, oh, they didn't have the stress. Yeah, they had stress. It was totally different. Remember, stress isn't just something that in a society we live in. Lying to standing is a stress. They did that too. So it's a relative type thing of what it is we're looking at. And then when we find it somebody, we actually can do a carotid ultrasound on them to see if they indeed do have plaques in their carotid arteries. So this one is pretty nice and clean, which is what we want it to be. We also do thermography, which basically is an opportunity to check 119 points. We can check 15 different organ systems by literally looking at as a response to stress on these. We can identify organs problems, lymph problems. We can look at the digestive health. How does the person adapt to stress? So we measure these 119 points. We measure the points, and then they sit in the room for 10 minutes in a cold room, and then we measure the points again. So the cold in that case is the stress. We have these 5 possibilities of a reaction. Am I going to lose the battery in this thing? Yeah, we're losing the battery. So we have these 5 possibilities, and so the first reading, this black bar is the first reading, and then the red bar is the reading after you've been in the cold room for 10 minutes. So in an ideal way, the body should be responding in what's so-called this normal reaction, which is about a half degree cooler under the stress situation. And here we see it was a rigid reaction, a hypo, a hyper, and a paradoxical reaction. And they all mean something different when we're looking at it. This is the report we end up getting. So there's 3 areas of the body where we should see under stress, it should get warmer. In your head, in your thyroid gland, and in your maxillary and mandibular front teeth. All the other areas of the body under stress will cool off, get colder, which is what it's supposed to look like. Thanks. And then what we end up seeing is this type of a report. So everywhere you see yellow, we shouldn't see things above the line when it should be below the line. You see down here, this is the big problem. So this is the right breast. So it's like, oh, there's something wrong with this patient's right breast. Well, this patient has breast cancer. Long before a mammography will find it, long before any other test will find it, you can see that type of, it doesn't take, you don't even have to have any training to know something doesn't look right. In the left breast, it looks at, there's probably this is either fibrocystic tissue or whatever, but there's some major problem going on here. We see the dental area, we see the sinus area, there's a lot of GI inflammation going on here, there's a lot of poor circulation into the head. We get lots of information from doing a thermography test. We also do a zytoscan, which is another way that we can scan a number of different things in the body. So what do we do with all that? So, this is your standard assessments when you go to the doctor. A history, a PE, blood tests, perhaps a urine test, some pictures, because what we're looking at is trying to figure out which of these organ systems are out of balance. So in addition to doing these, we've added all these evaluation tools. What we do is we get a much more complete picture for the patient itself. So when we do our assessment, it's not just about these, it's all the additional assessment tools that we use so that we can come up with a much greater variety of therapies. I'll let Dr. Drobot talk to you about all the therapies we use. Some of the therapies we use. It's going to be weird here. Okay, try it.
Hello. Good morning. Clicker. So usually we're teaching, is that going to feedback to you guys? Usually we spend a lot of time trying to teach doctors about dentistry, so it's always interesting to try to teach dentists about some of the medicines that we use. And I remember when I first got into medicine, there was always this talk about, and this was a million years ago, 15 years ago or whatever, and I always heard about biological dentistry, but I didn't know anything about it. And I think you don't understand the importance of something until you get to see it. And I think the first time I ever saw a cavitation get cleaned out, I didn't know what the hell it was, but I knew that that wasn't very good. And I think the problem with, we both have the same first names, biological, and then we kind of separate with our last names. Your name is dentist, my name is doctor. And I think the problem, it would be nice if we actually had an integrative clinic or an integrative approach that the patient understood that neither one of these two are more important than the other. It's important to do everything at the same time. Because for the patients that we see, I haven't seen a sore throat probably in 12 years. I always see the worst of the worst, so you have to have the most innovative technology and tool. I'm a technology junkie. I just saw somebody in the exhibitor room vacuuming up dry ice with a mercury vat. I just started getting a sweat. I almost pulled out my credit card, and we don't even do dentistry. So I want to show you some of the therapies that are out there because we like to travel around. We like to find the quickest ways to do stuff because oftentimes our patients have the shortest amount of time left. So if you can find the most innovative ways to do things, I don't think oral supplementation really, for my patient base or for our patient base, gets it done that much anymore. So we always go to maybe faster things. So I want to drive you through a little bit or a few of the therapies just so that you can kind of get some exposure to it. We're not endorsing anything. Dick didn't read his card like he was supposed to, but we're not endorsing any of these. We just use them. So I'm not trying to sell you anything. So always the goal is to treat multi-system problems. We always find the best technology to treat a particular system, and so if it's a lymphatic system, we use machines to treat the lymphatic system, again, in conjunction with everything else. So I want to show you some of these. Dick was treating this side of the room too nicely, so I'm going to treat this side of the room nicely and actually show you guys something. I'll get my laser pointer, and I'll show you guys something too. We'll work it. Wrong. So one of the most important things that we do with chronic disease is we have to put oxygen and electrons back in the body because if we don't have any energy production, in order to get something to heal, you need extra energy production. And in chronic disease, we actually don't have a lot of cellular energy. So we have to find some way to create this. I see a whole bunch of pro athletes. That's not a problem in their case. But with chronic disease, you don't even have somebody with decent amount of energy. They can't even, I'm going to say, function normally in a day. And in chronic disease, we're always in a race to get extra function out of these cells. So we have to use a whole bunch of technology to try to create oxygen and electrons. And there's lots of different devices out of there. Electron foot baths that most of you have seen, they're just, when the water changes color, I'm not going to say that there's nothing to that. But we like to use things to charge up, I'm going to say cellular power plants, because that's the most important thing. Everybody that we test in the clinic that comes in normally as a patient has a very low electrical potential. You'll hear Dr. Tennant speak today. He's got a great little machine that we have at the clinic, and it's designed to kind of measure cellular voltage. So some of the goals is to get voltage up as fast as possible. In order to do that, we use a lot of innovative technologies that can kind of do that. Singlet oxygen therapies, again, if you had two things that you wanted to do, one is increase oxygen, the other is increase electrons. Singlet oxygen, you can use machines. There's lots of them around. Air Energy is one of them. Valcuum's another one of them. Quite good because there's not many things that you have for treatment-wise that actually raise parasympathetic nervous systems. And everybody has such a sympathetic dominance that if you can get somebody to get into a more relaxed state or a more resting state, you can actually get them to heal faster. And singlet oxygen therapy is one of the most fantastic ways that you can get that done. When we're looking at other ways to do it, I want to just kind of go through this. Pulse electromagnetic field, so we use 3 or 4 different machines in the clinic to actually increase, again, cell voltage. Some of them are delivering a frequency. It's important in dentistry because there's lots of microbes around, so we want to make sure that we have frequency-specific therapies. Whether you're using microcurrent, I actually like to use actual current. So I don't know if any of you remember the Papimi machines or anything like that. That might not be the crowd to do this in. But that was an old machine. It probably weighed about 700 pounds. And it's like a cattle fence. And you would hold on to this cattle fence, and what it would do is it would pulse a whole bunch of electrical charge. And that whole thing was designed to actually increase every cell in your body's electrical potential. Because cancer cells have an electrical potential of about minus 40 millivolts, and normal cells have an electrical potential of about minus 70. So if you can increase the amount of electrons, or if you can increase the potential of those cells, you actually get to kill cancer cells a lot faster. Those machines are no longer allowed, but there are variations of those machines now that we use in the clinic, and again, half of them are designed to be battery chargers. And they kind of look like this. They all have a loop. I mean, this is about a 15-minute treatment. It's great for, in your world, it's great for jaw cavitations and stuff like that. There's separate heads that you can get made. So anybody that has an extraction, the first thing I want to do is pump a whole bunch of oxygen and electrons back in there, whether you're going to use ozone injections or whether you're going to actually have some way to heal that bone fast. You're always in a race for time. We always condone, of course, that people actually go and get their extractions out. I've seen a lot of people that you try to work around it or try to get root canals out, you try to work around it. To tell you the truth, I don't think that that's been that successful in my line of practice. I'm probably going to talk to lots of you that tell me otherwise, but in my mind, I get everything out because that's the fastest way to do something. EWAT is basically trying to get a bunch of oxygen in the system. So a lot of you are familiar with hyperbaric oxygen trainers or hyperbaric oxygen chambers. This one will probably do 20 times that. So in 15 minutes, we take oxygen saturations, and again, it's great for pro athletes. We take oxygen saturations up to 100, and then we drop oxygen saturations down to about 75%, which if anybody have walked into a hospital with oxygen saturations of even 90%, there would be cause for concern. But our goal is to pump as much lactate out of the cells as possible. So we can actually pump oxygen in, 20 times the amount of oxygen in, and then basically constrict the vessels, open them back up again, and we can get a whole bunch of lactates out. And that only takes 20 minutes. So we're doing probably 8 hours of treatment a day on the patient. And they'll do a variety of treatments, and I'll show you kind of the checklist of what we're looking at. Lots of these different I don't know if the old Vega testing, I'm sure there's lots of dentists in here that remember the old Vega testing. They used to put out a nice machine called an MRT, which basically kind of cleans up a lymphatic system. So it's like a magnet, goes all the way down the back. And one of our biggest challenges, as Dick said, because nobody comes in with a lymphatic diagnosis unless it's leukemia, is to clean this big area called your lymphatic system, which is tremendously difficult. Of course, the lymphatics drain under here, which is why that jaw is such a problem, because you're trying to get lymphatics to drain down here. I'm trying to get the rest of the body to drain up here, and we get a traffic jam right under these collarbones. And so our goal is always to try to move as much lymph as possible, because if you can get circulation, of course, into the teeth and into the jaw, it heals faster. And if it heals fast and you get rid of an infection, that's one less thing that the body or the physiology has to do. And to do that kind of stuff, we like to use a whole bunch of machines to actually move it. LymphStars, it uses noble gases. There's a photon genie. There's a couple of them. And again, in dentistry, it's a really wonderful machine because you get to strip out the lymphatics fast. And so you're not having a whole bunch of, I'm going to say, hypoxic tissue when you can move lymphatics. And we get huge results in the clinic just moving lymphatics. I mean, if there's one thing that I would pick, one therapy or one, I'm going to say, treatment modality that we'd like to use, I mean, it'd be lymphatics for anybody with chronic disease. Because the rest of it, if you can get that lymphatics to move and you can get fresh, you can get the vitamins actually to a cell and you can get waste products away from a cell, I mean, I promise you the cell heals. If you can't do that, which is why I don't like to leave things in the mouth, if you can't do that, I mean, you're just struggling against time. It's really hard. It's heavy lifting. There's another machine called an ST8. Again, a lot of the patients are trying to get into a parasympathetic state. You know, technology kind of will allow us to do that. I'm not a big proponent of, like, sit here and belly breathe a bunch of times because the person is already thinking about a stage 4 diagnosis. I mean, I'm not going to be able to tell them to relax out of that. So I like to use technology to allow them to get into a different state. In order to do that, we leave them on machines like this for an hour at a time. Lots of different lasers. We have K lasers and Q lasers and, I mean, multiple lasers. You probably know what lasers do. Increase circulation in areas, increase ATP into areas, so it's a really interesting treatment. Biomats, again, whole goal is to get people into parasympathetic states. If you go to the clinic and you spend a week there, I mean, you walk out and the person actually looks 100% different. And the reason is because their lymphatics are flushed and they're actually in a parasympathetic state. Does that hold up in the real world? I mean, when you teach cells how to do something that they haven't done for like 25 years, you'd be surprised. You know, what happens when you actually leave and you release them back into the wild. They do quite well. Sound beds, I mean, these are like, this is some of my favorite therapies are always ones that actually can do stuff when the person isn't aware that it's doing stuff. So a sound bed kind of looks like a big water bed, and what we do is we pump a whole bunch of frequencies out. And it kind of feels like being in the middle of a Tibetan, like, gong. So it's basically vibrating all your cells at a specific frequency. So if we want to pick liver programs, I mean, these frequencies for organs were figured out a long time ago. NASA kind of charted which hertz. Every tooth has a different frequency. So you can actually pick which frequencies you want. The biological frequencies, we're not really allowed to do pathological frequencies like Wright machines. But you can pick whatever organ you want to, and you can kind of dial up its phone number. And lots of studies show this. This is how acupuncture works. And you can dial up that phone number. You can keep playing that message to that cell. You add electrons, and you see a whole bunch of blood flow actually go to the organ heals faster. I like to use sound beds because it's like somebody sitting on a water bed again, and for an hour the person just gets conked out. And when they're out of my way, it's a lot easier for me to dial up, we'll say an intestinal program or we'll say a dental program, and I can actually pick and choose which organs I want to receive that information. They're laying down for an hour. They wake up. They've been on Mars. They don't know where they are. And we do our thermographies or we do a lot of our assessments, and we actually get to see that you move the numbers. And it was always a frustration for me because I used to do a lot of assessments, and then I'd test the patient again 3 weeks later or a month later, and nothing would have moved. And you have to face that patient, and you have to look at, that's why I went to a lot of technology, because you have to face the patient and say, you know, you just took $200 worth of vitamins, and well, here we are. And then you got to, you know, pay the piper a little bit. With machinery, I mean, you get to see things move really fast within a week. And that's the difference between technology and, I'm going to say, supplementation. And I think when you guys are, I'm sure all of you refer to alternative doctors. That's why you're in the room, because you're doing something alternative. I mean, it's always good to find somebody with a lot of technology, or to look and actually go and spend some time and have them come to your place so that everybody understands what everybody's doing. Because with that, I think you get the most effective therapy. Lots of different hyperthermias. So as Dick mentioned, I mean, immune systems are such a nightmare. We can't actually get somebody's immune system to get sparked up. So we have to heat them up to, 40, 41 degrees. And what that does is it creates heat shock protein. Somebody will actually stay in those tubes. It's kind of like an infrared sauna, but there's a whole bunch of magnetic frequencies coming out the back too. And your goal is to try to hold somebody in that heated position or try to stimulate that fever for as long as you can. Normally patients are very comfortable for about 30, 45 minutes, and you actually get those temperatures elevated. I'm going to say 95% of the people that we test don't even have a normal temperature. So if you don't have a normal temperature, you don't have a normal immune system. And if you don't have a normal temperature, you don't have a normal thyroid. So if you can't even get 98.6 or 37 degrees Celsius, and you go ahead and you do an extraction, I would argue that that's a very dangerous procedure because you don't have somebody's immune system that's actually going to go and clean that up. I mean, the goal would have been to do everything that you can to actually make that procedure as effective as possible. In order to do that, the best treatment the best treatment tool you're going to have is a patient's own immune system. If they don't have an immune system that's going to be able to do that, I would argue don't do that yet. Same with taking a whole bunch of amalgam out. If they can't eliminate stuff, don't take it out yet. I mean, it always made the most sense to me. It's hard because you have a patient, they say, what should I do? Should I spend my money on dentistry or should I spend my money on... And it's like, don't spend any money because if you don't do both of those, you're going to have a very difficult time trying to return it to health. Whole body cryotherapy is nobody's favorite treatment. You go down to probably minus 200 degrees Celsius. You stay in that nitrogen bath for about 3 minutes, and as bad as it sounds, it's worse than that. I hate it, but I mean, patients don't find it that bad. And in that 3-minute time, again, it's hard to, every single one of these machines is trying to boot up a system that hasn't been going for about 25 years. So what this one is specific for is a nervous system. So the patient will get in that tube right there, looks like a tanning bed, and we'll raise them up so that their chin is just above that level of the top, and then we'll just pour a bunch of nitrogen on them. And what that does is it stimulates, which sounds terrible, but it isn't again. We're very caring. We're doctors. We took an oath. What that does is you'll get 30-second or 3 seconds, I'm going to say sprays of nitrogen. And it actually turns your nervous system off. Your nervous system can't understand how that can get so cold. And so you shut the nervous system down. And then for about 8 hours later, after they get out, if they survive, I mean, they'll get 8 hours of continual immune stimulation because the nervous system, the peripheral nervous system is going to come back on. And for a lot of our patient base, that nervous system has gone to sleep a long time ago. It's not telling the brain there's a tumor there. So you have to go wake up that nervous system and say, can you please go do a sweep here because we've missed a bunch of stuff that we should have got. Colon hydrotherapy, everybody's second favorite treatment. Pretty evident what that's going to do. Anytime that you're detoxing, there's no point. I mean, the digestive tract is the size of a tennis court. A lot of people's digestive tract simply doesn't eliminate it. We've done tons and tons of stool analysis. You can see that the bacterial composition in there is not even what it should be. So sometimes you have to go in there and actually get a plumber and plumb it out. I don't like to use colonics so much for the detoxification purpose as I like to use for the, again, parasympathetic nervous system stimulation that you get off of that. We have lots of patients that come in and seem to do, it's a real fad to do 3 colonics a week for a year. I don't think that that's a great idea. I don't think you're doing much detox at all. I think you're terrorizing your system, and I've seen lots of results from that. IV therapies, we probably do 15 million of these. Different ones. You can, I'm sure all of you are familiar with vitamin C because that's what you kind of use in your practices. Glutathione because that's what you use in your practices. We do a lot of ozone therapy, so whole blood, major autochemotherapies. Put a bunch of remedies in there. I mean, there's 1,000 combination of IV therapies, and it's always specific for the patient. So when a patient comes in, we'll do the assessment. If we find organs are weak, we'll actually choose remedies, whether they're from Germany or whether there's lots of good things out there. And then we develop that treatment plan. So, I mean, our whole purpose is to find a weakness and to actually concentrate on the weakness. I mean, in chronic disease, if that weakness, I mean, we've done lots of thermographies, and the jaw always shows up. And it's probably the most frustrating thing to the patient. And again, our patient base is probably biased because they're sick. And so somebody has put something in their mouth that probably they shouldn't have. And so now we got to go in there, and when you're doing assessments and you can actually explain to a patient that this is an important part, you can develop a treatment plan that always includes one of you to go in there and actually do some work. I just wish there was more biological dentists because as many of you as there are, it just seems that we have a hard time finding somebody to actually do some work. And for me, that work is very, I'm going to say important and one of the first lines of treatment. And until a patient actually gets that work done, it's really hard to heal. So you should pat yourselves on the back because you really have an ace in your back pocket as far as chronic disease. It's just a lot of the population don't know it, because nobody talks about dentistry as far as health is concerned. Here's kind of, again, our therapies are what we have to do. Along this side, I'm going to get my trusty laser pointer, which I have now lost. Along this side, you can see the goal is to get the most coverage that you can on all these organs. So when you're treating, it doesn't matter what the disease is. If somebody has liver cancer, I promise you it's not because their liver is terrible. It's because they have cancer. Just happened to pick the organ that was the weakest. So you have to treat the whole body. I mean, I really don't believe in, even in athletics, I kind of made my money not treating one thing. We use technology to do a bunch of performance enhancing without having to do stuff that isn't allowed, I guess. And you get to do that by picking as many things as possible, as many treatments as possible to treat as many organs. You can see there's not that many organ systems. So in our practice, dentistry fits in because I could argue that dentistry obviously affects every single one of those, even though it'd be really hard to convince a bunch of MDs of that, even though I've tried several times. But it's important that, the patients understand that these aren't going to go anywhere. There's not going to be like a liver 2.0 coming out. So if we can kind of educate on what the liver actually does, we could probably treat that easier. And this list and Dick's credit card just keeps growing because technology is expanding in medicine. Like in dentistry, I get to go over to that, your exhibitor hall, and I see a whole bunch of new stuff. And that when I go to my medical conferences, I see nothing technologically advanced at least. All we really get to see is like a new vitamin that comes out, which really isn't that important. So I think we'll entertain questions now because we're probably running out of time. So her question was, I think I have it right, if I heard it correctly, what do I think about the Rife machine and the infrared sauna? So Rife machines are just a dirty word in the United States. So if you're Canadian, we can say Rife machines all we want to, but if, I kindly got asked to move a bunch of my technology down from Calgary down to Scottsdale because it was okay when I was treating like Olympic athletes, but it wasn't fine when I was treating chronic disease. So yeah, I mean, Rife machines, there's so many different ones. I really like biological frequencies a lot more than I like pathological frequencies now. So the trouble with the Rife machines is that it was really hard to get a test where you could actually figure out which organism you're treating. So we just did these huge frequency sweeps, where we go from like 0 to 10,000 hertz. And unfortunately, there's a lot of different biological frequencies in there. And to go ahead and ping as many as possible, I don't think that's the right way to do it anymore because it all changed with these things. When we kind of introduced wireless communication, and that was gigahertz, and when we took a nervous system, we terrorized it so bad with gigahertz that those Rife machines now, you don't want to go ahead and wake up every organism that you have floating around because you don't have an immune system that's going to do that. Far infrared saunas, I like them a lot. I think you need to get into your far infrared sauna when it's cold. Like that was the whole purpose of the far infrared saunas. People like to heat it up, and then they like to get into it. I mean, you've lost a lot of the therapy when you do that. The goal is you actually get in when it's cold, and then the far infrared is going to penetrate about 2 inches into you and heat you up. So I think that's the other thing I'd have to say with far infrared saunas, especially in Canada, is most of them are just coffins now because they come out nicely lacquered with a whole bunch of radios in them and stuff like that. The last thing I want to do is sit in far infrared, be lacquered, and then have an antenna and be dialing up my radio station while I have far infrared penetrating 2 inches into me. So I think these are like, it looks really nice on the surface, but if you're going to get far infrared saunas, because a lot of patients will ask you, what should I get? And unfortunately, you kind of make, that Heavenly Heat produces a great one out of California. They can do a steam, and I like the most boring sauna possible because I know it's going to be the least toxic. Yeah. Exactly, and so if you set that frequency, I'm saying most of them just do frequency sweeps now. And I think that's dangerous to do, especially, two patients that you're not sure what it is because you're looking for that Herxheimer reaction. And it's like, well, what did you do? How do you know which organ? Dick and I are heading off to Greece for 2 days, which is a lovely adventure, 25 hours in the air for 20 hours on the ground, I think, to pick up a new machinery from Russia, which is I'm going to say years ahead of any rifing machine that I've ever seen. and they use it tons. Is it time? Nice. I know when they get up, it's like, now I get down. That's what I do. Thanks.
Thank you, Dr. Drobot and Dr. Dickson.